Thank you very much, moderator. I've been introduced. So I want to go straight into the subject matter. Fortunately, my colleague Brenda has really softened the ground for me because he has, in a space of 15 minutes, gone through all these international treaties, regional and national level. And it creates a very good platform for me to dive deep into just one of them, the CBD. So I'll talk about the CBD as one of the key international formations, one of the key international treaties that guides everything that we are doing. And since we came here from the first day, everything that we have been doing is under the agenda of the CBD, except it is broken down into different pieces so that it can be managed. But it's very, very wide, it's very deep, and it's very intrusive in everything that we do. If I may start by asking, how many of us attended the last CBD, the Convention on Biological Diversity meeting that was held in Colombia? How many of us? Yeah, so you can see it's just a handful. And therefore it means that we have the obligation to at least talk about what happened there. And that's why I'm here, because I want to talk about the policies, the debate that took place there that led to different decisions. So as a recap, you know, the CBD is the main international policy framework which governs biological diversity. I think all of us know that. It is premised on three objectives: the conservation of biological diversity, the sustainable use of its components, the fair and equitable sharing of benefits. And I think we are very much familiar with these objectives, because at the CBD, these are the objectives that guide the debate that goes on. Now, the CBD and its protocols have continued to represent the main source of guidance for the living modified organisms. And since we came here, we have been talking about LMOs. We also call them GMOs. And gene-drive organisms are considered under the scope of the CBD and its protocols. So the protocols that have been established to support the CBD to attain its objectives are mainly 3 or 4. The Cartagena Protocol on biosafety, the Nagoya Protocol on access, benefit sharing, the Nagoya Kuala Lumpur Supplementary Protocol on liability and redress. And Brenda has ably quickly gone through some of these, the requirements of these protocols. So I'll dive deep into the CBD decisions that were made at the last COP meeting. Actually, it's a total of about 73 decisions. This is the outcome of the CBD meeting that was held in Cali. And for those of you who have attended the CBD meetings, it's a huge body of meetings that take place, and decisions have to be made. And if you are not careful, if you are not organized, you may not appreciate the work that is being done around, because you must be organized. If not, you run around like a headless chicken, because all the meetings are taking place at the same time. All the meetings are parallel to each other. So you must be very selective to go in for those meetings that have a relevance to your work. And for us, we have been very lucky, because the outreach network does all the homework of selecting and filtering. And so what we have to do is to follow like sheep. So we follow outreach network to wherever it is going, and it guides us to the meetings that are relevant to the work that we are doing. So in the COPMOP, the COP itself, that's the Conference of Parties to the CBD, there were 34 decisions. In the Cartagena Protocol meeting of parties, which is a meeting of the conference of the parties, there were 27 decisions. And in the Nagoya Kuala Lumpur meeting of parties, which is a meeting of parties to the Cartagena Protocol, which is a meeting of parties to the CBD, there were 12 decisions. And all those decisions impact the way we do our work. And so I'll take the liberty to go through the salient points of each of those decisions. I'll start with the decision that was made on risk assessment and risk management. This is very relevant to our work. And the good news about one of the outcomes of that decision is that it adopted the voluntary guidance for the risk assessment of living modified organisms, which contained engineered drives. As you know, the agenda on this agenda item had gone on for several meetings, and the community was divided whether we should be able to create some guidance document around engineered gene drives. And there was a group which was tasked to develop those guidance materials, and the CBD, in its decision on risk assessment, approved and adopted those guidelines. So we are very lucky. Now, those guidelines are going to help us to go beyond what is provided in Annex 3 of the Cartagena Protocol. And it will be a useful sort of guidance for the countries that want to develop their regulations for research and development and for testing. So I think that was a very good outcome. Then the Cartagena Protocol, the risk assessment and risk management also agreed on a new decision. They agreed that I think they should prepare a synthesis of all the information that was gained in the risk assessment and put it together. And I think that kind of information helps us very much when we are building frameworks for risk assessment. And going forward, they have, in the next plans they have agreed that they will hold some events to really work on more guidance materials. There's an online open-ended forum planned very soon. There is a meeting of the AIRTEG, of experts on risk assessment, and there's a capacity building development meeting which is going to take place in June in Brazil. So all these events will help us to really advance. Then there was a decision on synthetic biology. Again, synthetic biology was a subject that has been going on through various conference of parties, but fortunately this time they made some very good headway in terms of decisions. And one of the key decisions that was made was that because gene drive has been exhausted in terms of discussions, it would no longer be an explicit area of focus for the further work of the CBD. That doesn't mean it's not going to be discussed, but it will be discussed as part of the capacity development and needs of the CBD, especially along with access to and transfer of the technology and the knowledge, which is provided under the Cartagena Protocol. And then in that regard, all the work under synthetic biology will be undertaken in the context of the capacity building action plan of the CBD. And all that will make things move forward, because in the past, they had to really have to organize a decision on these matters at a conference of parties, which is now not necessary. The other decision that was made under the COPMOP, under the Cartagena Protocol, was the detection and identification of LMOs. As you know, this is a subject that is beginning to take a center stage. Unfortunately, many countries, even at the international level, they don't have enough guidance materials and documents on the detection and identification of LMOs. So this decision recognizes this gap and has put in place some strategies to overcome the deficit. And mainly, it has encouraged parties to use the BCH, the Biosafety Clearing House, to share information on especially new detection techniques for LMOs. And it has also asserted that and affirmed that the existing training manuals on the detection and identification of LMOs are still very relevant. So we are all encouraged to use those materials until new guidance materials are made available. The other decision was on the GBF, the Global Biodiversity Framework, Monitoring Framework, which has been going on for a very long time. And in Colombia, they actually made a lot of headway in prescribing an agenda how we should keep monitoring the decisions that are made in the Global Biodiversity Framework of the CBD. And several discussions took place because this is the largest, perhaps, decision of the CBD. But for our interest, we're only interested in Target 17. And that Target 17 speaks about biotechnology, and it was adequately considered. And we're happy that the decision deleted something which was going to make our work very difficult. It deleted an indicator which measures the progress of capacity building for biotechnology. Although we see it as a missed opportunity for tracking advancements, but it had a side effect to it because it was seen as something that would directly or indirectly create an impression that biotechnology is promoting is only for the promotion of the CBD objectives rather than. So there is something there that we benefited from. Then the headline indicator for Target 17 was approved and endorsed. And the benefit that we have for that is that it's going to give us an opportunity, maybe the first opportunity, to see a balanced representation of biotechnology in the CBD, where some of the benefits will start to come out. Because all along we have been hearing about risks and risks and risks, but this time we are going to see the benefits starting to emerge. There was a decision on biodiversity and health. This was a very healthy decision because it tried to actually advance the One Health approach. And this decision, in doing that, made many mentions of the benefits of biotechnology, which was again very new. And it also brought in a language which focused on financial and technical mechanisms for supporting capacity building. And it also encouraged parties to raise awareness on interlinkages between biodiversity and health, which we have discussed in this meeting quite elaborately. Then there was a decision on liability and redress. This was decision 10 under the Cartagena. This decision welcomes any efforts to update records of our efforts into the BCH, particularly the contact details of the focal points of the CBD. And it also appealed for capacity building and awareness raising in support of the effective implementation of the protocol. And perhaps one of the things it did was that it reminded parties, because there are some parties that have not designated competent authorities in their countries for the Nagoya Kuala Lumpur Supplementary Protocol. And it reminds them to do that. This was perhaps a last decision of interest for us, the procedure for managing conflicts of interest in expert groups. This was starting to brew up. The issue here was that a number of experts like ourselves were playing a very big role in influencing the decisions of the CBD. And some groups were becoming very uncomfortable. So this decision laid down a process, a transparent process and procedure to ensure that there's no conflict of interest. So they produced a new form which we should fill in for transparency and accountability. And it also maintains a party-driven nomination process to ensure that parties have a say and a voice in the decisions that will be made. And other elements which ensure accountability. So the next planned meeting of the CBD is in 2026, and it will be held in a country called Amemia. Try to put the map there. Amemia is a small country in the east, surrounded by Turkey, Georgia, Azerbaijan, and Iran. And we are needed to start preparing now so that we are not caught off guard with the agenda that will be discussed. And of course, it means that you have to internalize those decisions that I have highlighted. And it also means that you have to keep your eye on the website of the CBD, because they will post the agenda items, and then you have to go through the agenda items and read around them and prepare. And those who come from the countries, you have to start early discussions to get country positions and to prep yourself so that when you are there, you know exactly what to do and which groups you should join and what to deliberate upon. I thank you very much.